Matters, the program sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet, and I am the Manager of Community Outreach and Education for the Area Agency on Aging, and welcome to our show this evening. Tonight, we're having a topic that I don't think a lot has been discussed, and I would like to share information with our audience on adult daily living centers. First, I'd like to, before we talk a little bit about it, I want to introduce my guests. I would like to especially thank them for being so brave this evening and coming out. It's started snowing late this afternoon, and I just want to thank you all for being here with us and for the viewing audience. Next to me, direct to my left, is Bob Pettit, and he is the owner and operator of Ageless Harmony, and they have several adult daily living centers in Berks County. And next to Bob, we have Erin Garcia, and she is the admissions director for Phoebe Berks. And next to Erin is Kathy, and Kathy is with us to share a personal story where that she has had an opportunity to utilize an adult daily living center, particularly Phoebe, for her father. So welcome and thank you all for being here tonight. I would just like to start a little bit by letting folks know that adult daily living centers are regulated and licensed by the Pennsylvania Department of Aging, and they have an annual inspection that is required as part of the regulations. I also want to let you know that at our local Berks County Area Agency on Aging, we have an ombudsman program, and our staff ombudsmen are also required to visit the adult daily living centers at least once per year and do a complete quality assurance visit. So we also pop in and follow up with the adult daily living centers, the activities, the regulations, and do a little bit of making sure that the folks that are there are doing quite well and the care is being given to them. So without further ado, I'm just going to also talk a little bit about that adult daily living centers are required to serve the clients with functional impairment who are 60 years of age or older, or who are 18 years of age or older and have a post-stroke dementia, Parkinsonism, or a dementia-related disease such as Alzheimer's or another organic brain syndrome. So that's kind of the focus. And there are certain, as part of the regulations, we will talk about some of the goals of adult daily living centers, as well as each of the two with us this evening, some of their core programs and services. But first, I'd like to be able to have you all know that you can find a complete listing of the adult daily living centers on the Berks County Area Agency on Aging's website. So, by the magic of technology here, our website that you want to go to is www.berksaging.org, and this is the home page that comes up, and on our left side on the navigation bar, you will see it says Berks County Aging Resource Guides. Click on that, not the pop-outs, and if you click on that, here we go. And on the right-hand side, you see, second in line, is an adult daily living center guide. It's a little slow. And then you will see, oh, come on. Okay, there we go, a whole list of them. There are some on here that are in Berks County and a few that are outside Berks County. So please access that way. If you do not have a computer, then please, by all means, give our agency a call at 610-478-6500, and we certainly can send you this list. Look it over. You can, we give you the locations, the fees, the services, things like that. So, before we, and you'll see our agency's telephone number on screen at this time. Thank you. Some of the goals that are indicated with the older adult daily living services are to improve the quality of life of individuals with functional impairment, to provide respite for caregivers and the clients, to provide a community-based alternative to institutionalization whenever capable and possible, and to promote client functioning to the extent or the best extent of that individual's abilities. So I think that those are simple but direct. And so without delay, we'd like to talk a little bit about the specific core services that our two providers with us here today have. So I'm going to start, Bob, since you're next to me first.
Okay.
Tell us about Ageless Harmony and some of the really the core services that you provide to the folks that would be coming to your Adult Daily Living Center.
Well, I think core services, the basic goal of adult daycare, anyone who can't be left home alone, we want them to come in and see what we can provide for them. We design a program, a plan, a care plan for them specifically, but to put it in a nutshell, I think our main goal is to keep them safe in a secure environment, keep them well fed, keep them dry if that's an issue, and then promote social interaction with everybody else who's there with them. This is an important factor because in many cases they've been stuck at home and become couch potato. So they've lost all contact with the outside world other than their immediate family. And then you have the other side of the coin, the immediate family, the caregiver. They have a problem where their life stops when they all of a sudden have another job 24/7, and they can't do the normal things that they need to do for their own benefit. Mm-hmm. So we keep them safe, we keep them secure, we keep them fed, and I'm sure this is true with Phoebe as well. We serve a snack in the morning, then we have another snack in the afternoon, and then a full hot lunch. And if there are medications, we take care of that. Of course, we need all of the scripts and that kind of thing. But I think the most important thing is they can be interacting with other people, and the caregiver gets a break, and that's critical.
Okay, thank you. We'll
Okay.
come back for more specifics.
Sure.
And Erin, can you tell us again also what might be some of your basic or core services that you provide, and then we can go from there and expand on some additional services.
Sure. Our adult day center is actually called Tranquility Place. So it is at Phoebe, but it does have its own name. It's called Tranquility Place. And the way I explain it the most to families or people that are questioning is it's not only a respite for the family member, but a respite for the resident or the client. So I also describe it kind of like a holiday. Because when you come to the Adult Day Center, which Kathy can kind of speak a little bit more about because she is the daughter of one of our clients. So what they do is we really focus on making it the most enjoyable and fun experience for them while they're there. Not only taking care of their needs, but also focusing on their social aspects, just as Bob has said. And we focus on what's called Montessori-based programming. So many
tell
people,
us what that is.
Okay, many people have heard of the Montessori-based schools for children, but what Montessori-based programming is for those with some cognitive issues, some dementia, is really focusing on every type of activity or thing that you might do with the resident is really meant for a purpose. So, for example, when they come to the Adult Day Center, they may be planning the Thanksgiving meal that day, or they may be helping to make the lunch meal, or recently they planned a petting zoo that came, and they did all of that, and then they joined some other residents at Phoebe and had a great time, and also invited family and friends. They go on bus trips a couple times a week, so they plan those outings. We don't plan it for them. They have ideas of where they'd like to go, whether that just be a drive through the country or to see the leaves changing or the winter decorations, or it might be a specific destination. So really everything is meant for a purpose. We have some wonderful teachers and those that are experienced that go to the Adult Day Centers. So we have clients that actually teach an art class. We have a client who actually for a very long time led a daycare class. So she comes up with a lot of activities for the other clients that are there, because in her mind, she's still teaching. So not only do we focus on the health needs, so you can see a podiatrist while you're there, you can have your bath while you're there, you can see any of our audiology or dental services, you can get to your outpatient therapy while you're there, you can do all of those things while you're there, but at the same time it's really focused on the social aspect.
So I've got a bunch of questions going through my head. Let me just clarify also that you both, I think, said that you do an individualized care plan, Bob said, and then of course you said with a purpose. So, so whoever comes there, for every individual, you are both groups sitting down and mapping out a plan for that individual, because all of the folks, correct me if I'm wrong, that come there are all perhaps at different functioning levels. So what works for me may not work for you, and vice versa. So I think that's what's great is that it can be so individualized to that person, their likes, dislikes. I know if you set me down into I don't know that I do well in crafts. Okay, never was fond of it, but put me in the music group and I'm okay. So knowing that, I think, really helps to then make that day go better for the folks that are participating in the Adult Daily Living Center.
Yes, every client has a social assessment, which takes close to about 45 minutes to an hour. You can be doing that with hopefully you're doing it with the client and the family member, finding out what they like, what they don't like, because we don't want to have someone doing something that they don't enjoy. That's the point of coming there. And also a physical assessment. So if we have some specific goals, like walking a certain distance or certain care needs, those are all identified before the client actually starts.
Okay.
Also on the same idea with the Montessori concept, we've been using that for a number of years, and you'll find, as you just said, some clients will kind of lean toward the arts and crafts, others will want to go into drawing, whatever fits their particular needs. We have one program, we call it Workshop Wednesday, and the clients will rotate around to various tables and do whatever it is they feel like doing. And of course, with different levels, the client's going to seek their own level, and you try to encourage them in a particular area based on their needs and their capabilities, which of course is always assessed when they come in.
And then, speaking of assessment, I think that the also part of the regulations in this care plan is to reassess every 6 months, and so you're reevaluating and reassessing where they are in that plan, and if you need to re-strategize, redirect, change a little bit, and tweak it. Good. Well, we're going to hold the next couple of questions. We need to take a little bit of a break. We'll be right back.
You're watching bctv.org. Be informed. Be involved. Be a member. For membership information, go to www.bctv.org/support/membership. For other stories and information, go to bctv.org.
Welcome back. We are talking about adult daily living centers, and we have several in Berks County. We have two folks with us representing Ageless Harmony is Bob Pettit, and representing Phoebe Burks is Tranquility Place. Adult Daily Living Center is Erin Garcia. So again, thanks for being with us tonight. We talked about that folks coming in who are considering adult daily living centers are going to have a medical screening exam. There's an individualized care plan that is always reassessed and reevaluated every 6 months. I think the things that we were mentioning too is we talked socialization, because Bob was saying that, after time you tend to become so alone and so isolated in your own home that by making that step forward and going to an adult daily living center, they're being re-stimulated in a different way. It's a new environment, and maybe some new friends that they're making. Their mind and body occupied, and I think that we've seen that in all of us in prevention of some dementias. They're always talking about brain health for those of us, you know, so I think that's a wonderful opportunity for folks. Bob mentioned nutrition, snacks and meals, and medications. Erin, you have similar things. You're able to give the individuals medications should they need them, nutrition.
Yes, we always have a nurse always on duty. So we have a nurse who's on duty every day, and then to do medications or treatments or any of those things that would be needed. And then we also have a separate nurse who's there at least 2 days a week to do more assessments and follow up and just keep reviewing care plans and any needs that there might be.
Okay. I would like to ask, I think that we are open for home viewers, so please feel free to give us a call if you have any questions for the folks about Adult Daily Living Center. That number is 610-378-0426. One of the thoughts that came into mind is, well, how often, how long can I bring somebody to either of your locations? Can I, you know, if I'm starting out, I may be a little concerned if I've been the caregiver and I'm used to caring for this individual, whether it be a spouse, a husband, a father, or a mother, and I think I know best. But if I'm bringing somebody there, you know, do I have to bring them for a certain period of time? Can I change that along the way as well? So we'll start with you again, Bob.
Okay, we are open, all three of our centers, which we have one in Laureldale on Kutztown Road, Penn Avenue in West Lawn, and Grant Street in Mount Penn. All three are open 7:30 to 5, Monday through Friday. Now, we have a minimum of 2 days a week because anything less than that, you're not getting any benefit. And particularly in the case of Alzheimer's, if they were only to come 1 day a week, by the next week, they forgot they were there. So we develop a pattern with clients, and we get to know them better, they get to know us a little bit better, and we can better serve their needs. And it's a better break for the caregiver. And, you know, that's one of our primary concerns as well.
Okay.
They can come anytime from the time we open till the time we close.
Okay.
It's not a rigid schedule where you have to be here by 8 o'clock.
Or that whole day.
Or the whole day, yeah.
Okay.
And in most cases, 7:30, and, well, our Penn Avenue Center actually opens at 6:30 for extended hours for people who need to drop someone off before they go to work. So they're open from 6:30 to 5:30. That would be a horrendous day. It's just, I wouldn't want to be anywhere for that length of time. So some people will filter in anywhere between, I would say 7:30 and 10, and then they'll start filtering out anywhere between 3:30 and 5 or 5:30. So it's a open menu.
Okay. Alrighty. And Erin?
We are open 5 days a week as
Okay.
well, same hours, from 7 to 5:30. The way we break it up is anything over 4 hours is called a full day, and anything 4 hours or under is considered a half day. So anyone could choose within those time frames, and again, you can come at 7, or you can come at 10, or you can come at 2. It's what your preference is. We don't have a limit of the amount of days. I agree that you certainly, if you do not take advantage of more than 1 day, it's a little hard to adjust. However, we do have those family members that may only need 1 day a week for a husband or a spouse who has doctor appointments. So they may come once a month for 4 hours, and that's okay. So there's no limit as far as that. We do ask if someone isn't able to attend that they call and let us know that, you know, they're not feeling well or that they're not able to make it in due to the weather or something like that. But as far as our schedule, it is Monday through Friday, either full days, half days, anything in between, and no set schedule.
Okay. I would like to talk with Kathy now a little bit. Kathy has more of a personal response to the Adult Daily Living Center in that it was, she found it necessary to have her father attend the Tranquility Place, the one at Phoebe Burke's. And we were talking a little earlier, and I wanted to just mention that I know that it can be difficult for that caregiver to be able to accept that that individual needs some a little bit more guidance and attention, to accept that they've done as much as they possibly can, and the fact that they're exhausted in some cases. They've run out of steam, and it becomes then friction between the caregiver and the person receiving the care. And so it's not an easy journey for folks to look at and consider and plan for Adult Daily Living Center, but I'm pleased, and thank you, Kathy, for sharing a little bit about your situation. So could you just tell us a little bit? You were your father's caregiver, correct?
Yes, my father lives with me,
Okay.
and so I take care of him most of the time. My brother also helps, but you go through, it's like having a child, but it's not like having a child, and you feel responsible, but you can only do so much on your own or by yourself. And as a parent ages, they have mobility issues besides the cognitive issues, and it is better if someone else helps you, and yet you don't want to give up time with that parent or that spouse. And I found the daycare a great compromise. He's home, Dad's home with me at night and on the weekends, so I still feel like I'm in his life and he's in mine, but I don't have the burden really of the every day, every hour, every minute worry. So it's been a great compromise.
And I guess a balance.
A balance,
say,
yes.
A nice balance
Yes.
between the two. I think that we've been saying that, if you're able to do that, it allows that individual to thrive and grow
Yeah.
and learn. And it allows, as we said in here, the respite, or at least opportunities for that caregiver, for you to get something done. It's very difficult when the person, because they're living with you also, you are both there at the same time. You can't leave to get the groceries, the everyday
Yeah.
activities that you need to accomplish. At what point was there something that at one point you went, okay, we need something further than this?
Well, yes, I felt somewhat selfish about this, but I think it started to infringe on some choices I needed to make about other members in my family and my own life as well, finding a balance among all those things. So, and some health issues that my dad had sort of spurred me on to changing.
Okay. And I think, what did you see then? Now, I don't know how long he's been going to...
Since, not a couple months.
Okay.
It's amazing.
So
It's
tell us what you've
been
seen, the change
amazing.
in him?
Just
Have you-
much better cognitive ability, much better schedule. He's awake during the day and sleeping at night, which is helpful. And
which was probably turned around for a while,
yeah, that was
wasn't it?
backwards too. And it's just been really great. Good for him, good for me, and good for us.
What does he enjoy doing?
Singing. They at Phoebe, they make an effort to play or sing songs that he grew up with or he knew. He loves reading, likes watching movies. So pretty much everything he would have liked doing at home, he gets to do there. So it's all good.
And he's safe. And I think that's the other thing that you
Yes.
guys mentioned. You can feel comfortable that he's safe in a safe environment.
Yes. And
Occupying
his
time
life
and
is enriched.
mind.
Yes.
Yeah, and
Yeah.
it's orderly. And it allows you then the opportunity, as you said, you had other family members who, needed some
Well,
other
yeah,
attention.
and my own
yourself.
life.
Of
Yeah,
course.
it's not. I'm not really. I don't take care of everybody else, but that was, you asked if what was the turning point, and that was one of them.
Okay,
Yeah.
all righty. We have a few minutes left. I would like to ask our panelists here, Bob or Erin, what have you seen? Is there one little quick snippet or some little story, or what have you seen for the most part, whether it be on the caregiver side or the person attending the center? What What do you notice? What do you see?
I think the biggest thing that we can tell after maybe a week or so is the client becomes much more aware of what's going on around them. The caregiver becomes, you can almost see life going back into them. You know, they've got their life back and they don't have to suffer any of the guilt of a nursing home type situation because they know that their loved one is in a very safe and secure place. And we've had a number of times where people have come in and maybe we've had a music program going on and they'll join right in. And it's entertaining for us as well to see how things have improved over a relatively short period of time. And of course we get all the letters from clients who have been with us for extended periods of time saying, you know, we're lifesavers. And I'm sure you have the same thing with Phoebe. But having been doing this for 15 years and we kind of know what to expect with regard to changes in the elderly and how they respond, it's been pretty much the same for 15 years. And it's always, well, we like to think it's always in a positive vein. It's just such a tremendous thing for a client to experience and enjoy their days.
And Erin, you have...
I think there's so many positive stories, and each client is so individual. So when I go into the adult day center, I get lots and lots of hugs, and I get to sit down with residents as they're doing different activities and sing with them or do an activity with them. And we have a larger group of volunteers from the community who really, really express how much they enjoy being in the adult day center and working with the clients there. But I think one of the most rewarding aspects for myself is with being at Phoebe, I get to assist the families through every need. So for example, if we have a client who has unfortunately a fall or something at home and they need rehab services, they call me and I say, okay, come back over to Phoebe, we'll do rehab and get you right back into Tranquility Place. Or the family member calls me and says, I really need a vacation. I want to go away for a couple of days. Can you provide me a respite stay while I'm gone? And absolutely, let's schedule it. So it's, or even if it's just a phone call, this has changed and what are your thoughts and what can I do and how can you help me along the line? I think those are the most rewarding parts, and that the families feel like they have a resource. So not only are you providing those services on a daily basis and providing a little bit of relief for both the client and the family member, but that's the best part, I'd say.
Terrific. Well, we could probably talk another half an hour this evening, but we don't have the time, so I need to do a little bit of a wrap-up. I want to encourage anybody who's watching tonight to give us a call at the Berks County Area Agency on Aging. We can kind of help you with some thoughts, guide you through perhaps some questions to ask of these folks who are providing adult daily living centers, and supportive services supporting you with those resources. Remember, they're online. Give us a call. We can send them to you. Talk with these people. Both have said that they are open to people stopping by and observing the activities at their locations. And I think that always makes us a little bit better when I can see it. It's tangible. And you can see the folks enjoying themselves. So much more on adult daily living centers we could talk about, but I encourage you to investigate for those who are considering it. It is an important resource out there for both the caregiver and the person receiving the care. So please check that out and give us a call at the Berks County Area Agency on Aging. And that's it, and have a good night.